Hello, everyone. My name is Rupa Radhakrishnan. I am a neuroradiologist at Indiana University School of Medicine. First of all, it's great to have you here. Welcome to IU. This is a great place. We have a wonderful MR physics team, and I must say, I'm just really happy to have a wonderful relationship with our MR physicists. I admire their knowledge, and I'm really thankful to be able to collaborate with them on both the clinical and research aspects. I am mainly a pediatric neuroradiologist, and my interest is in fetal and neonatal neuroimaging. From a clinical standpoint, I try to optimize our MR images. As you know, the neonatal brain is different compared to the adult brain. It's not myelinated, it's much smaller. We also image our neonates mainly without sedation and during natural sleep using something called the feed and swaddle technique. So it's really important to have obtain images that are quick, but with higher resolution, as well as with good contrast and signal to noise. So we cannot just use the routine adult parameters for our infant images. We just optimized our infant neuroimaging protocol. And I'm thankful to say, with the help of our MR physicists, we were able to do a good job. We also recently brought the functional MRI in children to the Riley Hospital. Previously, children who needed functional MRI for pre-operative planning to identify the motor cortex and language regions of the brain, they actually had to travel to the adult hospital to get that done. But after quite a bit of collaborative work with our physicists and myself and the MR vendor, we were able to finally bring it to Riley, and our children no longer need to have to travel outside the hospital to get this service. It's really great to have that collaboration and be able to work together to solve problems on the clinical realm. For research, I use advanced neuroimaging techniques, mainly in neonatal neuroimaging. We use resting state functional MRI. We use a variety of diffusion techniques, including DTI. We use IVIM, or in vitro incoherent motion. We also use the multi-shell diffusion, or NADI technique, in neonates. They're all, I think, optimized much more for the adult brain. They're used much more frequently on the adult brain, not so much in the neonatal brain, which is why it requires a lot of physics expertise to be able to translate all that imaging for the neonatal brain. We also use resting state functional MRI, again, which needs to be adapted to the neonatal brain. We're a predominantly Siemens site in terms of MR, but we do have different types of Siemens scanners, and for research, we employ more than one scanner. So I always try to optimize the scan sequences across different scanners so that they may be comparable. And again, I have to rely quite a bit on our MR physics team to allow that to happen. I think I'm very thankful and that we have such wonderful MR physicists. We share a great cordial relationship, and I learn a lot from them. Um, I must say, this is a place where you would get wonderful clinical experience. You would get wonderful training. It would be a great place to work with the experts, essentially. And should you have any interest in clinical research in neonatal or pediatric neuroimaging, I would be happy to work with you.